In this video, we're going to be discussing elbow pain in baseball players. This is a very important topic because baseball players require strong grip strength during batting or pitching. If neglected, tightness of the forearm can occur, which can cause pain radiating towards the elbow. Keeping these muscles flexible and strong is especially important for pitchers. The stress of repetitive throwing can lead to an injury to a specific ligament that helps stabilize the elbow, called the ulnar collateral ligament, or UCL for short. Here are some key exercises to perform to keep these muscles strong and flexible in order to stay on the field and avoid injury. In this exercise, we're going to be stretching out the muscles on the back side and front side of our wrists. First, let's do wrist flexor stretch. With the arm positioned out in front, elbow straight, pulling straight down on the fingers, you'll feel a nice stretch throughout that front side of the forearm. Holding for 30 seconds, perform 3 times. Next, we'll hit the back side of our forearm, the extensor stretch. Same position, now our palm is positioned downwards, grabbing our wrist, pulling straight down. You should feel that stretch right throughout that back side of the forearm. Again, holding for 30 seconds, performing 3 times. In this grip strength exercise, we'll be working the muscles on the back side of our forearm and the front side of our forearm. Flexors in the front, extensors in the back. We'll need a dumbbell for this exercise. You want to grab one that can perform at least 10 repetitions. So we'll start with the flexors. Stabilizing your elbow onto the table. Drop your wrist down with the dumbbell in hand and position the palm towards you and back down. Up and down. Again, 10 repetitions. Once you're done with that, you can flip your wrist down, hit the extensors at that point. Again, 10 repetitions, stabilizing the elbow the entire time. In this next exercise, we'll be hitting our wrist pronators and supinators. Supination is palm up, pronation is palm down. So for this exercise, you're going to need a dumbbell. Holding the bottom end of the dumbbell, start with your wrist at a neutral position or straight out in front like this. Grabbing the dumbbell, stabilizing the elbow, drop the palm down nice and slow, and then back up the other way. Again, trying to keep a neutral wrist throughout this movement. Nice and slow, back and forth, 10 repetitions. For this wrist strength exercise, we'll be working our wrist radial deviators and ulnar deviators. So if you have your wrist in a neutral position, pointing the thumb towards you is radial deviation. Pinky down, ulnar deviation. So for radial deviation, we'll actually need a dumbbell for this exercise. Grabbing the dumbbell, again, stabilizing the elbow, dropping the wrist down, thumb towards you. All the way down, thumb towards you. Again, picking a way you can perform at least 10 repetitions with. For ulnar deviation, we'll need a TheraBand. So my left hand's gonna be the working hand here. Holding the TheraBand out with some tension, elbow straight. Try to position the pinky out and back. Out and back. Again, 10 repetitions here. In this exercise for grip strength, we're going to be focusing on squeezes. So here I have the grip squeezer. You can use a towel that's rolled up or even a stress ball, but grabbing that object, again, stabilizing the elbow, squeezing hard for 5 seconds, and relaxing. Squeeze, relax. I like patients to do this multiple times, 30 repetitions. This exercise is called the farmer's walk and it's for grip strength. What you're gonna do, you're gonna grab a challenging amount of weight and walk back and forth for about a minute. You wanna be up nice and tall, engage the core, pulling the belly button towards the spine, elbow straight, and walk. Nice and stable without tossing and turning on each side.